¿Qué haces? No. Yo no te dije que lo voy a sacar. ¿Estamos o no estamos? Me avisas, Bolaños. So hello, good afternoon. Welcome back. Today we will have interesting case. But before to start my case, I would like to explain a little bit the new technology that we will use in this case. Okay. This is the new US scopes. I like to use the radial and linear scope for my evaluation, and I would like to show you the new US scope from Pentax Medical. This is a new design, very ergonomic, with a lot of difference from the first the T series from the same company, but this is a very complete different design. Okay, so one of the big advantages is that it's less heavy when you compare it with the other one. I don't know if you are looking to my scope. ¿Me puedes traer el otro de endoscopio? Gracias, el radial de la serie K. So, before this series, the J10 series, we had the K series, okay? So, there is a difference from both scopes. So, in terms of the characteristic, the radial continues to be the same. Very similar tip. So we have a image that is a front view image, very similar to a gastroscope. You can see both the scopes. This is the K series, okay? So the other from the radial, the other important aspect in the ergonomic part is this one. Ten aquí. Quiero ver esta parte. So the distal part, the proximal part of the scope is the ergonomic is totally different, as you can see here. You see? So we have here two insertion of cables, and this is just one insertion. So the change performer for this new J10 series in this ergonomic part is very important because now the cables are here. I don't know if we can see a little bit. Despacio. Okay. You can see here. Look. So this change make the scope less heavy than the before technology that we already had. And also this is totally different. Huh? The adapter to the ultrasound machine is completely different now. Now it's very small, really small, and this comes from this part. And this is very interesting. And finally, the other important aspect is that with this scope we can perform a retrovision. Okay. With the K series, the last generation of a scope, podemos hacer una, por favor. You see? Look. Ten. Okay. Look. So the angulation is completely different, okay? And so we have more degrees of angulation, and this is a very good aspect. So we can do a retrovision if we need it, okay? And we have also the linear. The linear scopes have improved a lot also. is also less heavy. The same characteristic regarding the ergonomics. ¿Me prestas el otro tubo? The same characteristics, and I would like to show you the big improvement regarding the ergonomic aspect, not just for the physician, also for the patients. Okay, so this is the tip is totally different from the last version, the K series scope. You can see it's less heavy also, the J10 series, really less heavy. So to perform endoscopic ultrasound, therapeutic, or even diagnosis is really important. So you see the big difference. This is very heavy, and this is because of this technical aspect. Okay, the cables were put here in the proximal part of the scope, so this was not good. And the other improvement is the tip. I don't know if you can see, it's a big difference, and the quality of image of this new scope, the J10 series, really improved a lot. Not just for the machine, I think it's also because of the crystal part of the scope. The other really important aspect is that this part was really heavy. You can see here, you see, so okay, look the difference. It's less centimeters from the tip, and this improve a lot the insertion of the tube, not just in the pyloric part of the stomach, from the stomach to the duodenum, also in the first duodenal part and the second duodenal part. So this change, you see here, you have at least 6 centimeters, and here we have at least 4 centimeters. So it's 2 to 3 centimeters less, and it's more angulation. So we can do also a retroflexion. That is very difficult and very hard to do with this scope. So this is some ergonomic and technical parts of the new tube. And I would like it to show you, because this is very interesting advance in terms of this new platform of US scopes. Okay, so I will perform my US today. Then the case that I would like to show you is a 44 years old woman with a history of cystic pancreatic lesion, and appears an augmentation of the usinate process. Okay, so I will start my US evaluation with my radial scope. I like to go faster. I am using now the new US machine, ultrasound machine. That this is the Arieta 850. The quality of image have changed a lot. You can see now. This is very sensitive ultrasound machine. So now I am at the level of the cardia. We see the liver and the aorta. I will see a quickly evaluation of the mediastinum. I don't see any mass, any lymph nodes, and the other anatomic aspects are okay. So now I will do my second part. This is why I love to use my radial. I will go inside the stomach. Now I see the splenic vessel here, the celiac trunk here, you see here, And now I found my pancreas now here. So I am the level of the body of the pancreas here at 6 hours. You see the quality of image of this scope. One of the main advantage also is this one. I can increase my image, you see here, even using my radial. So now I see very well my body of the pancreas. I see my main pancreatic duct that is very well, no alterations. And I am trying to find any lesion here. That's a small bowel. So now I am going to the tail of the pancreas, and I see this alteration, this lesion here. I will use Doppler now, fine flow Doppler. So this is a cystic lesion here. This patient just have abdominal pain, but doesn't have any increase of laboratory parameters. So now I will see this. This is a cystic lesion, isolate the cystic lesion. And one of the differential diagnoses for this lesion is serous cystoadenoma, but we have other differential diagnoses, and it's very important to evaluate this lesion. I will show you how we'll evaluate by US. This is a macrocystic lesion, and could be also mucinous cystoadenoma. And we have also neuroendocrine tumors and pseudopapillar tumors, because this is a woman. Okay, so I am trying to see if there is any communication with the main pancreatic duct of this lesion. I don't see anything. Okay, I will pass a little bit faster now. No sé si podemos ver la parte endoscópica. So one of the advantage also of the radial is that we can see in forward view. You see? Exactly like to perform upper endoscopy. So this is a very ergonomic scope. Now I am here in my bulb, and now I will pass to my second portion. Okay, so I need to evaluate also the uncinate process now. Podemos ver la imagen de ecográfica. Gracias. So I am at the level of my third part of the duodenum. Okay, so now I am looking to my uncinate process. Okay, here. So I don't see nothing in the uncinate process. It's perfect. So my uncinate process is okay, and now I am going to the head of the pancreas now. Here is the head of the pancreas. Here there is no any abnormality. Okay. So again, this is the head of the pancreas here. So you see the quality of the image is very good. So this is one of the new technology that we have now available. in the Americas. So now I will change my tube. I will use my linear and I will perform a fine needle evaluation using Confocal in this case, because I need to see if this patient have a cerocystodenum or any other kind of cystic lesion. So this is very interesting, very important, and to evaluate the patients. There are some papers, even one from our group, that is there is a new meta-analysis already published in gastrointestinal endoscopy with all the series where we evaluate the new technologies for cystic lesions, and we demonstrate, and the meta-analysis also demonstrate that this is very important to evaluate the lesions with new technologies, because these cystic lesions sometimes, when our macrocystic lesions, are very difficult to define what kind of lesions we have. So now I am using my linear scope. You can see one of the advantages also the window to see using the ultrasound. Okay, so now I am looking to my lesion. You can see, no sé si podemos ver la imagen endoscópica. Just to show you how we look, how we see the endoscopic part. You see, we cannot see the tip of the scope. It's easier to pass. You see, in the pyloric part and also in the second portion. It's really easier with this scope. The maneuverability is technically improve a lot. So now okay, necesito mi aguja. Sí, por favor. So I will pass my needle. Now I will use a 19 gauge needle. Vamos a hacer contraste, ¿no? ¿Tienes el contraste ahí? So now I will use, because of the history of abdominal pain, I will use contrast with this machine, just to evaluate So we have the lesion here. So I will explain a little bit what we will see, or what we are looking for using the contrast in this lesion. So the pseudocyst lesion doesn't perform a captation of the contrast. Second, the other cystic lesion, they will perform a captation of the contrast. Okay, and the pseudopapillar tumors that are cystic lesions, in those cases doesn't perform a captation. Okay. So in this context, we will evaluate using contrast. So now we will see there is no. I am not using contrast now. Me avisas. Ok, listo. Pone la mitad de primero de la ampolla. So I will start my count. ¿Ya está pasando? Sí, la mitad está bien. So the contrast is arriving. You see? Okay. The arteries, there is a captation of the arteries. But I don't see any captation of the wall, the cystic wall. At least now. Oh, a little bit now. A little bit here. Just here, huh? So, but this is not a hypercaptation. You can see this is hypercaptation. This is the artery, and here not. Okay, and this is the parenchyma. So probably, at least now, for my evaluation, just with this technology, I believe that probably it's not a cerocystoadenoma. Okay. So now I will pass my needle now. Está precargado, ¿no? Yeah. So I have my confocal here. And probably the amount of liquid will not be a lot, but the idea is to try to see a little bit. So now it's very important to push the plastic part. I'm trying to see is there any communication. I don't see any communication with the maybe there with the main pancreatic duct. It's not a communication. It's not a really communication. You see, I think it's just yes, you see, it's like a superposition of image, overposition of image. You see here, the main pancreatic duct is here, to my opinion, here, and continuous. You see, when there is a communication, we see the main pancreatic duct finishing here. So I don't see that there is any communication now. And I will try now to perform my punction. Okay, so now I am inside and my confocal is out. ¿Podemos ver el confocal, por favor? Confocal. Oh. Really interesting, huh? I'm trying to see a very good image. This is not a serous cystic lesion, huh? So now we can confirm now that this is not a serous cystic lesion, but I'm not so sure that this could be also a mucinous cystic lesion, huh? I don't see projections. I don't see papillarity. So so I believe that this is not a this is probably a pseudopapillary tumor, because if I see all the characteristics, this is a woman, young woman, first. Second, this is a cystic lesion in the body of the pancreas, near to the tail. The localization is not fantastic, but just for the age of the woman, of the patient, I believe that is that. Third, there is no captation with contrast, and this is not a pseudocysta. So this is probably a papillary tumor, huh? So I don't see any parameter. This is a vascular lesion, you see, no vascularity. We don't see anything, okay? So I don't see papillary projections. I don't see RUAT-NET image. So, to my opinion, this is no, this is a pseudopapillar tumor. Okay. So now I will retire my confocal, and I will pass a Murray biopsy forceps, and I will finish my procedure. Okay. Me pasas una pinza Murray, por favor. Cuidado. Te muevas. No hagas nada. Okay. Listo, retira. So I will pass a Murray biopsy forceps, and I will finish my procedure. So I think one of the big advantage is not just the technological improvements regarding the, por favor, la aguja. This is the Murray forceps, okay? So we pass through the needle, close, and I will finish my procedure. So we are finishing our full paper regarding the new technologies for evaluation of this cystic lesion. So now I am inside. ¿Puedes abrir? You see, it's open now. We see very well. This is one of the characteristics of this machine. We can see very well. You see, very well. The quality of the image of ultrasound machine is fantastic. That's why I love it. Okay, close, cierra. You see? You see? Oh, I have tissue now. So no blood. Okay. ¿Sí? ¿Abre? Abre, hijo. Aquí está todavía. En la punta está. So my technical assistant is not good. He's in love now. That's the problem. See? So we have two very good tissue, and I will pass again. my Murray biopsy forceps, just to have more tissue and a good confirmation, okay? Okay, abre. Okay, abre. So now it's open. Cierra. No, abre. Cierra. Okay, now it's okay. So we finish. I will perform an aspiration, but I don't have too much liquid now. So I will finish now my case. I will do some comments regarding the tissue. You see, I don't have too much liquid. So we finish now. I think everything is inside the needle. Okay. Listo, terminamos la transmisión. Thank you so much. I think this is a pseudopapillary tumor, cystic lesion. Okay. Thank you so much.